friends, welcome back to Twin Cities Live. It's time to thrive with Twin Cities Live. As we get a little older, our bodies age along with us. Were you aware of this?
Stupid bodies.
You might start to feel it in your spine. You know, your spine is often associated with problems in the neck and the back, but it can also cause issues in your arms and your legs. But don't worry, there are treatments available.
That's right. So join us today on our Thrive with Twin Cities Live and talk about age-related spine symptoms and at what point you should consider surgery is orthopedic spine surgeon Dr. Joe Wick from TRIA Orthopedics. Doc, thanks for being here. What an important issue. Let me just go right now and say, like, I got this pain. No kidding. I'm not kidding. It sort of like hurts right on my scapula. It could be a pinched nerve. I don't know. We can talk about that later. But this is a big deal because even as I get older, things just get out of whack. You know, whether it's like mowing the lawn or you bend over to pick up something, like you get back pain from just doing normal things. So what sort of things as we age that we have to look out for with our spines as far as like symptoms of degeneration or other issues?
Yeah, that's a good question. You know, think about back or neck related issues causing pain in your back or neck itself, but oftentimes patients will actually develop radiating arm pain, leg pain. Things that we think of as sciatica are often due to disc herniations or arthritis in our backs, pinching nerves and causing leg type symptoms. And actually patients can do really well recovering from those with both conservative treatment or surgery.
So you say surgery is really the last resort, even though you do surgeries. Okay. What are some of the things that you're thinking about in terms of, you know, treatments that can really make a big difference to people so that they don't have to get to this operating table?
Yeah. So again, surgery is the last resort. Oftentimes we'll start, you know, with more conservative treatments, physical therapy, because it works. Patients can see a substantial amount of improvement with it. Injections are often something that we use both to help diagnose problems and hopefully treat them. And for patients that have symptoms that are persistently bothersome despite physical therapy and injections, those are the patients that we talk to about surgery.
Okay.
Yeah, and some of the stuff I'm gathering is like, it's not, as I kind of laid it out, it's not always something that happens as a result of like a movement. Like sometimes just the way our body sort of like is aligned, or you could just wake up one day and be like, what is going on here? Like, I'm feeling this pain in my foot, and then you go to the doctor and realize like there's actually a pinched nerve in your back. So that's also something. I know we kind of think about these things in sort of events, but your back sort of like gives out sometimes and pinches when you're not even expecting it.
Are people often surprised that like the pain they're feeling in their arm is actually related to their spine? What a cool connection.
Yeah, it's interesting and can be surprising, and there can be a lot of crossover too between neck-related symptoms, shoulder, hand, hip, and so it takes a fairly thorough evaluation to make sure that we get to the bottom of what's causing the symptoms. One of the really nice things at TRIA is that we have easy access to specialists, not just for neck and low back, but also for shoulder, elbow, hip, and so it's easy for us to really get a comprehensive evaluation of people's problems, get to the bottom of it.
So we've kind of mentioned pain along with like the extremities, but can it be like hot cold sensitivity? Like how else in other ways can it manifest? Like it's actually a back issue and a spine issue and not maybe a hand or foot issue.
Yeah, certainly pain can be a symptom. If it's severe, you could have weakness, you could have changes in sensation, hot, cold sensation. For patients that have compressed spinal cord or pinched spinal cord, they can even have problems with balance, hand function, bowel bladder issues, more severe instances.
Okay, so when you think about, you know, for patients, when do they know that they should go to TRIA versus maybe like their primary care provider? Because if they're feeling like, okay, I just am going to my regular physical and I'm saying I'm a little bit tingly or something like that, how should they assess, okay, TRIA would be the place, and then what is the process like once you're in the TRIA situation?
Yeah, so one of the nice things that we have at TRIA is it's a very comprehensive system and we have everything under one roof. And like we talked about, physical therapy is a great starting point for a lot of these problems, and physical therapy is something that we have, and we have very experienced spine and neck physical therapists.
Isn't it wild how much PT can help?
Yeah, I'm constantly impressed by that. And so even getting them in to TRIA for physical therapy can be really helpful, and if they're not seeing improvement with that, we have a number of other specialists, both non-operative spine specialists and spine surgeons that we can get them tied in with it as well.
So if you're feeling any kind of pain or discomfort or something is off, it's worth just going into TRIA to getting it checked out.
Yeah.
They might be able to get to the root cause. Is it cool when you're at a party and you get to tell people you're a spine surgeon?
I don't get out as much as I should.
You gotta take some time off.
Yeah.
Doc.
I mean, like,
Yeah.
hey, what do you do? I'm a spine surgeon. Immediately, it's like, wow.
Well, the thing is, the problem is though, you're going to be just like people like me.
I
I'll be at
know.
the party, and be like, really? Okay, can you assess me? Can I get a free appointment right now? And all of a sudden, you're going to have a lineup of 30 people that just want to see the doctor.
It has to be really rewarding, though. I mean, this impacts people's daily life, their inability to move, their inability to experience their life without pain. When you are able to operate on somebody, or have them go through PT and then have it shift for them, is that incredible to see?
Yeah, a lot of what we do is focusing on improving people's quality of life, and that's really fulfilling when we can help them get back to what they're wanting to do.
That's really awesome. All right.
Yeah,
Well, can
keep
you take
changing
a look
lives.
at help
I know.
Ben with his
We're gonna-
shoulders?
Yeah,
so he
we're going to go to
stops complaining
commercial, and I
about
want
it.
you to take a look at my scapula. I don't know what's going on. All right, so TRIA combines research, education, and the latest treatments to provide life-changing orthopedic care. You can learn more at tria.com/spine. You can also schedule an appointment online or call the number right there on your screen. You're going to find this information also on our website on TwinCityLive.com.
Okay.